Hello, my name is Holly Haynes, and I'm here to discuss our strategic planning initiative that we would like to initiate on the oncology unit here at the hospital. Patients that have had a recent hospital stay are surveyed on patient satisfaction in certain areas. One of these areas that they are surveyed on is pain management. On the oncology unit, we deal with a lot of different types of pain, whether it's chronic pain, acute pain, nerve pain, anxiety that presents itself as pain. There's just many opportunities that we have to make interventions to make our patients more comfortable. Over the last several months, the survey has shown that the patient satisfaction related to pain on the oncology unit has not been very good. We felt like this was a place that we needed to desperately make an intervention. One of the most important things to us is our patient comfort. We don't want anybody to lay there and hurt. So I called a unit meeting and I asked each of our employees to come up with one idea that could help make our patients more comfortable. We met a week later and we discussed everybody's ideas and voted on 3 things that we felt like could improve our patient satisfaction and comfort. The first is the verbiage that we use when we're assessing the pain. Generally, the nurses and the nurses' aides will ask the patient, "Are you in pain?" But when the survey comes out, the verbiage that is used says, "Was your pain controlled?" Well, we know that dealing with cancer patients, they're probably always going to have some level of pain, and I felt like that we're probably not going to get every patient to a 0. So we felt like that we could start asking the patients, instead of saying, "Are you in pain?" we're going to ask them, "Is your pain controlled?" So when they get the survey, they can connect the dots and perhaps realize that while we may not have made their pain a 0, we did make interventions to control their pain. The second thing we'd like to initiate is hourly rounding. Hourly rounding is not new to nursing by any means. It's not new to our hospital either. But over the years, it seems like the hourly rounding has stretched to 2-hour rounding, maybe 2.5-hour rounding. So we felt like that we needed to start a schedule where the nurse and the nurse's aide see the patient every hour. The nurse will go 1 hour, and then the next the nurse aide will go, and then the nurse, and so forth. This way, someone that can actually make an intervention is laying eyes on our patients every hour. We not only treat with medication, but we also do position changes. We can do soft music, which we have on our TV system. We have position changes, imagery, and then we have these pain kits that we hand out on admission. And this pain kit contains things that will promote comfort. Earplugs if the noise is loud, cold packs for their head, maybe one of the sleeping masks if they feel like it's too bright in their room to sleep. The third intervention that we decided to make has to do with nurse leader rounding. And this requires that the nurse leader or unit director make a visit on each new admission. So she'll get a report every day on the admissions the day before, and those are the patient rooms that she needs to go specifically in and meet the patient. At this time, she will discuss with the patient, if you're having pain, this is how you're going to access pain medicine. You need to call the nurse and ask for it if it's ordered as needed. I'll make sure that they know how to use the call bell, and just make sure that they're 100% clear that if they're in pain, they need to ask for an intervention. At this time, we decided that the best way to monitor for pain is to look at our HCAP scores that come in every month. The Performance Improvement Department does a report every month and sends it to the Chief Nursing Officer, the Divisional Director, and to myself. This is a great way to measure if we've made progress or not. And the fact that the report comes monthly, if we notice that maybe 1 or 2 months in a row we haven't made improvement, then that gives us the opportunity to sit down as a group and maybe come up with some different ideas that could help improve our pain scores. So basically, the nurse has a role, the patient has a role, and the unit director has a role. And if we all work together, then hopefully our goal will be to improve our patient satisfaction. Thank you.